Hello, and welcome to our presentation on the research method of phenomenology. The research method of phenomenology has an objective that is to describe, understand, and interpret the meanings of experiences of human life. Phenomenology is a type of humanistic research which focuses on human beings, human meaning, and human actions in research. Data collection from research participants is influenced by a researcher's experiences, reflections, and interpretations. These lived experiences of the study participants are obtained through the researcher's underlying philosophical interpretation of the research data at hand. So what is phenomenology? This is a research method that utilizes a qualitative approach. It is humanistic and interpretive, where the researcher interprets subjective data that is provided by the participants' experiences in the study. Inductive reasoning is also used, which is the act of making generalized conclusions based off of specific scenarios. It also utilizes a basis of knowing, and this looks to provide meaning, discovery, and understanding of human experiences. This focuses on theory, which helps to develop theories and also describes them rather than explains theories. Data is measured and gathered by utilizing interviews and observations of participants. Data is collected in the form of words and text. The findings of this type of research method provide an understanding of phenomena that is being researched. What are the steps in phenomenology research? First, the researcher must choose a topic and identify a shared or lived experience. This way, the researcher can look to better understand a specific experience or phenomena that has occurred. What's next? Recruiting a sample of participants. Researchers will specifically look for participants that have experienced or share the same prior phenomena. Next, bracketing is performed, where the researcher must set aside personal beliefs and perspectives to allow for participants' views and meanings to appear unbiased. Then the data collection begins, which is done by recording interviews in notes and/or audio recordings. The interviews can consist of open-ended questions, open conversations, participants describing their observations, as well as diaries or other written materials from the participants to use as a reference source. Then reduction of data is performed. The next step is describing themes. One can be textual, or what did the participants experience? The other is structural, or how a participant experienced a phenomena. Thoroughly exploring common themes and clustering them together is then done. This is used to develop a structure and highlight the common ideas from the data. A researcher must complete this process for each participant to develop a common set of themes to be viewed after all of the data is collected by each participant. These found themes are then analyzed and compared to other types of research data that may have been gathered to ensure accuracy and clear representation. A narrative is then developed by the researcher, which includes excerpts from participants' experiences, along with interpretations from the researcher to ensure understanding of participants' experiences. An overall description of the meaning or essence of the experience is then constructed, and the researcher is able to prepare a final report of the findings of the study. Now let's take a look at a clinical study that utilized the research method of phenomenology. The title of this study is, "What is the lived experience of being discharged from a psychiatric inpatient stay?" The purpose of the study was to understand the personal experiences of patients who were discharged from an inpatient psychiatric admission and why the discharge process can be so difficult for them. A sample of 8 participants was chosen for the study, aged 26 to 65 years of age, with an average time of 20 months since their last hospital admission. They were recruited through 3 community mental health teams and outreach team programs. We utilized interpretive phenomenological analysis through interviews to do data collection. This study wanted to focus on the why the discharge process was so difficult for these patients after an admission to a psychiatric hospital, rather than focusing on the quantitative data such as suicide rate for after a hospital admission. The study focused on the specific experiences of patients who were discharged from the program. Interviews were conducted with these 8 patients, and they were then analyzed to develop common themes. 4 themes resulted from the study: leaving the hospital, the outside world, the journey to health, and self-identity and beliefs. Within these themes, common focuses on patients were as followed. For leaving the hospital, they felt as though they decided when you were well enough to leave the hospital, but that doesn't mean that you are better. You're just well enough not to be there anymore. Feelings ranged from joy and relief to fear and anxiety. Some felt powerless, that the discharge process was something being done to them, being told to leave the facility. Some did feel that they were home when they were discharged, but some did also find that this could trigger the same emotions and responses that led to their original admission to the psychiatric hospital. The next theme is the return to the outside world. A lot of patients found that adaptation took time. There was difficulty accepting help that was needed from others. They felt that they were needed to relearn how to live in the outside world instead of the hospital. These then triggered fear, and they had a notion of fending for themselves. They also felt pressure to live a normal life by themselves and or with family, and they also sought out ways to avoid feelings that were negative or difficult. And for some patients, this could trigger relapses if this had to do with drugs or alcohol or harmful behavior. The next theme is journey to health. Participants' experiences of recovery as part of the discharge process was often common. With medication, some viewed it positively when others viewed it negatively. Some felt that medication had helped them to make their problems feel invisible. A lot viewed mental illness as something as to be a fight or a battle. There was also a fear of needing to return to the hospital potentially, feeling as though it was always lurking over them in the background. With the theme of self-belief and identity, this incorporated issues relating to their identity as having a mental illness. For normality, it is what they thought was normal or what they thought others to be defined as normal, which could affect how they were behaving in the outside world and around others. Many of them often felt judged and labeled due to having mental illness, which caused feelings of rejection. Many would also try to identify with different mental illnesses, such as changing to depression versus identifying as having borderline schizophrenia or borderline personality disorder. They often did this to try to decrease that feeling of rejection and being judged by others. The study also came with limitations and challenges. The findings were generalized. Only patients who were categorized as well enough to participate were provided with the study's information. This means that patients who were not sufficiently well enough to participate could have led to different experiences, which could have also resulted in different themes that were resulted from the data collection. Patients' experiences and memories may have also changed or faded since their experiences upon recollection for the study. Again, an average of 20 months since their hospital discharge was the average time for each patient. Care also varies across the country, so experiences may differ depending upon the amount and type of care that's available to patients both inpatient and outpatient. Further, it may have been helpful to specifically inquire about different team support during discharge to see differences in reasons for experiences and readmissions of patients. And that concludes today's presentation. Please see our references for today's presentation. We thank you for your time and hope that you feel that you learned a little bit more about the research method of phenomenology.